All right, last month, GBMC earned the title as a Resuscitation Quality Improvement Lighthouse organization. To tell us more about this honor is Director of the Division of Medical and Surgical Critical Care at GBMC, David A. Vitberg. David, welcome to the show today.
Good morning. Thank you for having me.
All right, so tell us, how was GBMC Healthcare able to achieve this title?
So GBMC has led the way in training its clinicians in CPR. Traditionally, people go through 2-year recertification cycles. They go to a full day of classes. They have to pound on a mannequin, sit through hours of lecture. GBMC started something called the AHA RQI, Resuscitation Quality Improvement Program, where we have carts deployed throughout the hospital, and we do very low dose, high frequency training, meaning we go to these carts at least once a quarter, do training, do compressions, do ventilations on the mannequins, do computer modules, and continuously practice for our resuscitation skills rather than just once every 2 years.
Okay, and this training was recently credited for saving the life of a woman who was in cardiac arrest. Can you tell us what that was about?
Yeah, it was an incredible story, and thankfully a story of survival. She was a grandma-to-be. She was visiting her daughter, who was actually in active labor in our labor and delivery suite. And as she was walking out of her daughter's room, she didn't feel well. Initially, they called a rapid response, and our team came and assessed her for having chest pain and not feeling well, but quickly deteriorated into a cardiac arrest. And she actually went into cardiac arrest in one of the back hallways of our labor and delivery area. And we had a team of about 30 to 40 people converge on her and do CPR and use the skills that we learned through this AHA, American Heart Association, RQI program that I just spoke about. And we actually provided high performance CPR to her, upwards of 40 minutes. And miraculously, after about 40 minutes, we got a pulse back. We transferred her to a neighboring hospital where she had a cardiac catheterization, a prolonged ICU stay, but then she actually went on to make a complete 100% intact recovery. And we had the very amazing situation where we got to meet her last week. She came back to campus and thanked some of our staff. And it was just really a miraculous thing, probably a once in a career thing for me.
Oh, that's amazing. All right, so what does it mean for GBMC Healthcare to receive such a high honor?
So the AHA RQI Lighthouse Award recognized us for being the first in the state of Maryland to adopt this technology that we used in that situation. And actually the reward was really her and her family coming back and thanking us and seeing her smiling, looking good with her daughter, her grandbaby. So the award is nice. The RQI Lighthouse Award is nice, but it's really the byproduct of that award that really kind of lifted our spirits at GBMC.
I'm amazing. Thank you so much for sharing this story with us, David.
Sure, you're welcome.
All right, take care.